Hi, Mrs. Smith. How are you?
I'm good.
Wonderful. I'm Miss Hayes. I'm your nurse aide for today, and I have the pleasure of washing your feet. I am going to provide privacy. Before I get started, I am going to go and get some water, okay?
Okay.
All right, so you want to get water first because you have to test the water and you got to get them to test it. It's wonderful. Can you test it for me? Is that okay?
Yeah.
All right, perfect. So after I get the water and test it, I want to put my gloves on because it's hard to put gloves on and then go try to test the water, right? I'm going to raise the bed up so that it can be at a level that's easier for me. Because at all times we want to protect our back. Do you mind if I uncover one of your legs? Okay. Alright, I'm going to remove your sock and pull your pants leg up. Okay. I'm going to provide a barrier, which is the towel, and you want to do it a long way like this, okay? Gently pull the leg up by the ankle, using the same joints that you would use for range of motion. Go ahead and submerge the foot into the water. I need you to bend your leg. And take the basin up to her or him so that it's a comfortable flex for them, okay? This is the washcloth. You want to submerge it in water and kind of rinse their foot off. Make sure it's all the way wringed out, okay? Apply your soap, but you do not want to put this back into that water because you need it for your rinse. Remove the foot. You can slide that up or you can put it back on the table. But if you're not doing a lot of wiggling and jiggling, it should be fine. But you want to wash the entire foot. You want to go in between those toes. Slide the basin back. They will bend. This is dirty. Now I want to rinse the foot. Bring your washcloth out. You're no longer needing this. So you can put this over here. Go ahead and rinse the foot off, even between the toes. Hold by the joint so it's comfortable for the resident. Okay, this is dirty. You want to dry the foot with the same towel you used as a barrier. Even dry between the toes. You want to then put lotion on, and the lotion does not go between the toes. And give them a nice massage while you're at it. Feel good, right? Alright, any excess lotion you want to take off. This is dirty as well. You want to put the resident's sock back on, a clean sock. This is testing and demonstrating purposes. Pull their clothing back down. Okay, and I'll be right back. So this is going to be emptied into the sink It's going to be rinsed out, and the rinse water is going to be poured in the sink, and I'm going to dry it out as well. Pouring out, rinsing out, and now I am drying it out. This goes back into the designated dirty area. I'm going to remove my gloves properly. Every time I remove gloves, I wash my hands. I'm going to lower the bed. This is your call bell. Let me know if you need anything. Put it within reach in their hand. And the skill is complete.